We will first describe the materials needed to perform this procedure: nasal endoscope of 0 or 30 degrees, physiological saline solution, inflation pump for inflating and controlling the pressure inside the balloon, extension tube, angled insertion instruments through which the catheter will be introduced into the Eustachian tube, Tubavent, balloon catheter, nasal suction tubes, a bayonet nasal forceps, and a nasal speculum. We will usually use insertion instruments with angles of 45 or 60 degrees on adult patients. The kit also includes an insertion instrument of 70 degrees that we will mainly use on small children. Unblock the pump by sliding the locking lever sideways and fill it with saline solution. Slowly pull the plunger as you would with a normal syringe, trying to prevent air from entering the system. Once the pump is full, the system must be purged so that no air is left inside it. Lock the pump again by sliding the lever back to its original position. The 45-degree insertion instrument is usually used on adult patients. Remove the protective plastic from the tip. Carefully remove the catheter protection. Pay special attention not to bend it. We can see there is a second protection with a stabilizing guide. This will also be removed. The catheter is now ready to be used. The catheter has a black marking on its distal end, which will help us determine how far we will introduce it in the insertion instrument so the tip does not appear on the proximal end. We will carefully introduce the catheter in the chosen insertion instrument up to the beginning of the black marking. We can observe that if the marking is overpassed, the tip of the catheter will appear on the extreme. Prior to the preparation of the surgical field, we will use tampon strips with a vasoconstrictor so as to achieve the maximum possible permeability of the nasal cavity. These tampons will be removed after a period of no less than 10 minutes once the surgical field is in place. In order to start the procedure itself, we will first perform an endoscopic exploration of the nasal cavity. In this case, we can observe the presence of abundant mucus accumulated in the rhinopharynx. We will extract the mucus and clean the cavity by aspiration. As we have previously seen, we must remove both protections from the balloon catheter. Place the catheter inside the inserter, taking care not to bend it. The black mark serves as a reference to check that the tip of the catheter does not protrude through the end of the inserter. Adjust the end of the pump's extension to the distal end of the catheter, making sure they close properly. Insert the inserter with the balloon through the nostril and locate the torus, pharyngeal ostium of the Eustachian tube. Once the torus has been located, place the end of the inserter into the orifice, making sure the tip of the catheter is completely hidden inside. Slide the catheter through the inserter until it is completely inserted. Once the balloon has been placed inside the cartilaginous section of the Eustachian tube, inflate it by turning the pump plunger clockwise until a pressure of 10 bar is reached. Make sure the pressure is kept stable for 2 minutes. After 2 minutes, unlock the pump by moving the key to the left and empty the balloon by pulling the plunger as if it were a syringe. Once the balloon has been emptied, lock the key again. Extract the deflated balloon. In this case, and purely for demonstration purposes, we will once again show how to inflate and deflate the balloon. Remove the tampon strips with vasoconstrictor that were placed before the preparation of the surgical field. Before choosing the angulation of the inserter to be used, it is advisable to explore the nasal cavity and the torus. In adults, the 45-degree inserter is usually used. Insert the catheter into the inserter, in this case the 45-degree one, until the beginning of the black mark previously mentioned. Fill the pressure pump with saline solution and purge it. Connect the pump to the distal end of the catheter. Move the inserter forward through the nasal cavity, locate the torus, and place the tip of the inserter in it. Once the inserter is placed in the torus, move the catheter to its stop inside the inserter, thus introducing the balloon into the cartilaginous portion of the tube. Excessive resistance will indicate a wrong insertion of the inserter and therefore the possibility of rupture of the balloon at this point. Inflate the balloon by keeping the pump key closed and turning the plunger clockwise until reaching a pressure of 10 bar in the pressure gauge. This pressure must be maintained for 2 minutes. Torus after the dilation.